have heard of or experienced one of the most common knee injuries in America, a torn ACL. In fact, it's actually the most common ligament injury in the United States. Some of you may have had a friend or know somebody who has had this injury. Maybe you had a fantasy quarterback who tore his ACL last year. Anyways, in today's world of highly competitive sports, it is very common to see this type of injury. It can happen to both athletes and non-athletes. However, many people don't actually know the anatomy behind this type of injury. Today, I'm here to explain how athletic trainers diagnose and treat this injury and what it takes to recover from a torn ACL. To start, it's best to understand the anatomy of the knee. Bones are connected by ligaments. In the knee, 3 bones meet to make the knee: the femur, the tibia, and the patella. Then there are 4 ligaments that wrap around the knee to stabilize it together. On the sides, you have the medial collateral ligament and the lateral collateral ligament, and these facilitate movement from side to side. The other 2 ligaments are the posterior cruciate ligament and the anterior cruciate ligament, better known as the ACL. This facilitates back and forth movement in the knee. These form an X right across the front of the knee. Now I'd like to talk about how an ACL injury is diagnosed. Injured ligaments in medical jargon are considered sprains and are measured based on severity. A grade 1 is the least severe, which is just a mildly stretched ligament, but the patient can still walk on it. A grade 2, a little more severe, is where the ligament is stretched to where the ligament becomes loose, better known as a partial tear. However, a grade 3 is a complete tear, which is actually the most common ACL injury, where the ligament is broken into 2 separate pieces. Now that you know a little bit about the anatomy, I'll explain the reconstruction process of the knee. It is necessary to stabilize the knee with the ligaments, or else you wouldn't be able to stand up straight. Doctors use autografts, which is actually a piece of tendon taken from another place in the body, commonly in the hamstring. And this, after the damaged ligament is completely removed, they funnel it through tunnels through the bone and feed the new tissue through to hold the knee together. The recovery time can be different for everybody. Although you can go home after the surgery, the process can take up to 6 months. According to Feller and Webster in the International Orthopedic Journal, only 82% of patients return to a sport of some kind, while only 63% return to the sport that they played previous of the injury. After surgery, according to the UPMC Health Beat, you will be on crutches to prevent applying weight to the knee on the first couple days after surgery. In the 2 to 4 weeks following the surgery, patients can begin to apply more weight and start attending physical therapy multiple times a week. In the 2 to 6 months after the surgery, patients can finally return to, after coming up with a plan with the doctor, can return to play in the sport that they want. While the recovery can be mentally and physically draining, it is worth being back in the field after surgery. In conclusion, anyone can tear their ACL. Although common, very few have no idea what it takes to come back from this type of injury. After listening to my speech today, hopefully you know more about the anatomy and the recovery process of an ACL injury. Next time a friend or one of your favorite athletes goes down clutching their knee, now you'll be more prepared to understand the process of what it takes to come back from an ACL injury. Thank you.